Welcome to the Nurse Shark Academy Show, a Baxter Professional Services production. Welcome to the Nurse Shark Academy Show. The Nurse Shark Academy Show highlights nurse business owners and others in the healthcare field who promote entrepreneurship. We interview nurse leaders and encourage them to tell their story. My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. You will dream big and expand your consciousness as an entrepreneur. Join us and support these wonderful nurse entrepreneurs and leaders. Today's episode is how one nurse turned a concierge business into an international enterprise. And our guest today is Giselle Mettam. Attention nurses, looking to take your nursing knowledge and turn it into a viable business? Ready to take action, but don't know where to start? Join the Nurse Shark Academy. We support nurses as business owners and leaders. We offer career and entrepreneurial coaching for nurses or other healthcare professionals. Whether you're a brand new nurse, a seasoned health professional, or building a startup, join a community of support. Entrepreneurship can be lonely, but it doesn't have to be. Our career and business coaching services are designed to help you achieve the life-work balance you desire. Our experienced coaches will help you identify and attain your career and business goals, enabling you to become more successful in both your personal and professional life. I'm Tina Baxter. I founded the Nurse Shark Academy because I believe every nurse is a hero on his or her own epic journey. Nurses are launching new businesses every day. You don't have to do it alone. Join the Nurse Shark Academy and get the support, training, and coaching that you need to launch your successful nurse business. Become a member at the nursesharkacademy.biz. Hello and welcome to the Nurse Shark Academy Show. The Nurse Shark Academy Show highlights nurse business owners and others in the healthcare field who promote entrepreneurship. We interview nurse leaders and encourage them to tell their story. Today's guest is Giselle Mettam, and Giselle is located in the UK. She's in London. She's a co-founder and an executive director of operations at Metta Health, a medical concierge service. Welcome to the show, Giselle.
Thank you so much, Tina, and thank you so much for having me. I'm so excited to be here.
I was so thrilled to meet you and to hear about what you're doing over in the UK, and you happen to be our very first international guest.
Yay, that's fantastic. Excellent. Thank you.
That's so wonderful to hear what nurses are doing all over and to really spotlight nurses. And it's just for me, it's just so gratifying. So I'm going to ask you that first hard-hitting question, right, that we always ask. What made you become a nurse?
Oh, well, I've always been a people person, and I've always wanted to help people. My mum and my grandmother were very kind people, and they were always helping people. So they kind of instilled that in me from a young age. And in terms of nursing per se, it was actually, I was motivated when my dad was ill and had to be hospitalized. And I just wanted never to be in a position where I didn't understand what was happening with my dad or my mum in the future.
Oh, you know what? That's great. And often that catalyst may be a sick loved one, a sick pet, or just being around, others in the healthcare field. How did your parents feel about you becoming a nurse? Just out of curiosity.
They were really excited. I think they always knew that I would become either a nurse or a doctor. And they just wanted me to do what would make me happy. And so they were thrilled when I decided I wanted to become a nurse, because they knew that it meant that I would be helping people, spending my life helping people.
Oh, that's wonderful. So tell me a little bit about your background. Where did you go to school, and what was your first nursing job?
So I've had quite an international existence. So I come from the Caribbean originally, and have lived in the UK for most of my life. So I did some schooling in the Caribbean, but most of my tertiary education has been in the UK, as a matter of fact, all of it. So I studied nursing here in the UK and did my master's and various courses here in the UK. So that's kind of my educational background. And my first nursing job was in cardiac nursing, so to do with the heart. And it was my first ward because in our training, we have the kind of all the education, all the theoretical training,
Mm-hmm.
and then we have our placements, right? And
Right.
my first placement was on a cardiac ward, and I knew from that moment that I wanted to be a cardiac nurse because I just loved it. There was something so special about nursing people whose engines or their hearts, there's something wrong with their hearts. So the psychology of that really drew me to those patients.
Oh, that's wonderful. That's wonderful. I'm always curious about why certain specialties and what draws people to those specialties. And so tell me a little bit about your nursing journey because you went to graduate school. What did you study in graduate school?
So I did initially. I'd started doing a postgraduate degree in nursing, and I decided then that I wanted to make a switch because I wanted to challenge myself. And so I ended up going straight to a master's program, and that was in applied research and quality evaluation because I wanted to understand more about how policy was developed. So we have all these policies in health and social care, right?
Right.
And I wanted to understand how they were developed, how research was used. Because we talk about evidence-based practice, and so I wanted to understand more about how that was done and how it would shape policy. And obviously, the quality element was really important because what's the point of having a policy in healthcare if the focus isn't on the quality of the healthcare? So my master's degree in applied research and quality evaluation brought all of those things together.
No, that sounds great. That we always preach about evidence based practice, but yet I think sometimes there's still a lot that we do because we've always done it that way.
Yeah, right. Yeah,
And it's great to see nurses taking um, the initiative to really develop the studies and develop the policies that inform how we do nursing today. So I applaud you for that.
no, thank you. Thanks very much.
Yeah, I think that's awesome. So where did you go from there when you got your graduate degree? Did you stay at the same hospital? Were you still in cardiac or?
Yeah, so I can honestly say I was so in love with cardiac nursing that when I was a nurse in practice, I always worked in cardiac care in one form or the other. So after I did my master's degree, I at the time I was doing research. So I was doing research in cardiac care, specifically pacemakers and defibrillators. So the electrophysiology of the heart, because that fascinated me. Um, and from there, I went into project management and service improvement and service transformation. So I was part of a huge organization, which was a network. And the focus of that organization was transforming cardiac care across the county.
Okay, okay. And so you started with the organization, you kind of grew in what you were doing. So you were actually helping to get some of the policies and the research done to help the nurses that were still, working bedside, and they're going to implement what you came up with, right?
Yeah, absolutely. And part of that, part of what I was trying to do was to help with nursing education at the time because I wanted the nurses to be upskilled
Hmm.
and to start really focusing on that evidence based practice. so that they could, improve the quality of the care that they were giving. So that was a really exciting time for me. And after that, I went into operational management, and kind of progressed up to senior operational management up until board of director level. So my kind of last post before I became an entrepreneur was senior operational management. So I was in charge of hospitals, and that was quite a challenge, working 18-hour days.
I can imagine.
And being in charge of A&E departments and cancer care and outpatients and all those things that make up the healthcare system. So that was a huge challenge, and it was certainly character building.
So before we get into your entrepreneurial journey, what was the biggest lesson you learned being at that level, what we call the C-suite level, right? That boardroom level, and how did you navigate to that? Because I imagine it's got to be challenging as a nurse,
Yeah.
and to try to um, sometimes have that seat at the table. So tell me a little bit about that experience.
Well, I mean, that was quite interesting, because when you're a nurse on the ground, or even as a middle manager, you if you're working in a hospital, you're working in an organization, you get messages from the board of directors. You don't really have a sense of how those decisions are made, and where the decision is made and how the decision is made, to communicate to the rest of the hospital or the organization. So that was quite eye-opening for me. Um, it was just really interesting, and I think what I learned about that was that what's really important, especially as nurses, that it doesn't matter what role you play. It doesn't matter how high you climb or who your colleagues are. What's really important, that we're always the patient's advocate, and that we keep the patient at the center of everything that we do. And always think of the patients as your relative, your mum, your dad, and your decision making then will be sound. And that's what I learned. So I've always carried that, with me, whatever role I played. And I've played so many. I mean, I've given you the condensed version.
Right.
I've played so many roles in the healthcare system, but that's been my constant. And I tried never to lose that, even when I was on the board of directors. And in actual fact, sometimes when decisions were being made, I would ask the question, what about the patients? What about the carers? And I'm quite proud of that.
Well, I want to thank you for being an advocate in that arena, and uh, having served on boards myself, it is sometimes very difficult to make those decisions when you're looking at budgets and allocating resources and making sure that you're fair and equitable. Those are things that can be a challenge, because you want to help everyone, but in sometimes if you try to help everyone, you help no one.
Yes.
And how do you make those decisions? And so that's great. So when you transition to entrepreneurship, what was that like, and how did you decide to become an entrepreneur?
So that is the $1 million question, isn't it? Um, really interesting. I think so. I'm going to be really honest. Um, I think when you work in the healthcare system for a long time, and you're giving of yourself constantly, and you get to the point where you start questioning yourself, and why you're there. Um,
Yes.
and you get to the point where there's this feeling of not being appreciated, and when that kind of overtakes your joy in what you're doing in terms of, the health, whatever job
Yes.
you're doing,
Mhm.
then you have to start thinking, what do I have to do to grab that joy back? What is it that's going to make me feel really happy? Because there's something happening here. There's a chemical reaction occurring here, which means that I am not the same person I was. And I don't, I'm driving to work or whatever it is, and I'm not feeling joy. So I need to do something different. I still want to have an impact on people's lives, but perhaps I want to be able to do that maybe a little bit on my terms, because I've given so much. So now
Yes.
it's time to do something on my terms, and grab that joy back, so that I can feel that I'm making a difference, but doing it in a way that suits, my work, for work-life balance, and, all those things that come into play when you're making such a big decision, because it is a huge decision. Um, and I think that people underestimate the transition. That and right.
Definitely.
It's
Yeah. We have this idea that we're just going to go hang out our shingle and all the money's going to come and all the clients are going to come. Yeah.
yeah, yeah,
Mhm.
absolutely. I mean, because you've got good intentions, and you want to make a difference, and you you've got this amazing vision, and people say that's absolutely fantastic. You do, as you say, you think that the clients are just going to come, and that things will fall into place. Um, and when that doesn't happen, it's a bit of a shock to the system. You think, okay, no, you've made this decision to do this. Now you've just got to do it. And so I think that transition psychology is really important in all of this, and the journey that you take through that transition. Having said all of that, I'm glad that I made it. I'm glad that I made that decision. I think it was the best decision for me.
And I want to pause there because that's so important. A lot of times nurses are afraid to try something new, do something different, or even put themselves first. And I always say, you have to shore up your own resources before you can continue to give out to other people. The whole
Yeah,
saying, if you can't give from an empty well. And I think a lot of nurses right now are struggling with that emptiness, but don't know what to do or how to navigate that.
yeah. Uh,
So tell me about your business because I'm curious. You said you have your medical concierge business. So what is it that you do at your business?
okay. Um, so what we do essentially is, um, let me put it this way before I get to that answer that
Sure.
question. There's something contextual that's really important, and that's the fact that COVID has left us this legacy of waiting for healthcare, and that's a global issue. It's
Yes.
you
Yes.
know, it's a global issue, and it's a very um, pressing global issue. Okay, and it's the same everywhere, and it's just a matter of how different countries organize their healthcare systems. That kind of determines how well they cope with that legacy, because we've all got it. Um, and so with Metta Health, so we are a medical concierge company, as you said, and what we do, we want to support with that issue, because waiting for healthcare, everyone's got the right to have healthcare, whoever they are.
Yes.
And waiting for healthcare can be painful, it can be distressing, it can be frustrating. Um, and what we wanted to do is provide people with an option, you know, with an option to have healthcare that's rapid, affordable, perhaps in a different country, but getting that healthcare as soon as you can, good value for money with the best outcome possible, because that's what most people want. And that's essentially what we provide at Metta Health. So we support international clients to come to the UK to have private, high quality, rapid, affordable private healthcare. And what we essentially do is we do a healthcare needs assessment with that person, and based on that healthcare needs assessment, along with their diagnostic profile, so their blood results, scan results, images, etc., we find them the right consultant to give them the best outcome possible for them. We're connected to a network of world-leading clinical specialists in the UK, all at the top of their game. And once someone discusses what their issue is, we can then go out to the network and find the person who will give them the outcome that they're looking for. And that's really important. What is it they're looking for? What's their lifestyle? What does good look like for them? And then matching them. And we're very niche in the way that we match the consultant with the patient. And that's because we know that a good match will produce the best result possible.
Yes.
I'll give you an example of that. We have a number of very highly qualified, experienced orthopedic surgeons. And they do, you've got hips, knees, legs, feet, hands, you name it. If someone who is a young person and who's athletic needs a knee replacement or a hip replacement, so for instance, Andy Murray, who's one of our best tennis players in the UK, had hip replacements. The person that we would get to operate on that sportsman or that young person who wants to continue playing sports or they live a very active lifestyle would be slightly different to the surgeon that we get to operate on an older person. Not because of discrimination, but because of the fact that in older people, the pathology is slightly different. You've got all this wear and tear, and so you want someone who's used to working on
Yes.
older joints. By the same token, if it's someone who's sporty, you want someone who has an interest in sports medicine and who has worked on sports people before and got them back to what they were doing before. So, and that's what I mean about we're very niche in the way that we select the right consultant for the patient and for the client. Now, what we also do is we arrange airport transfers, we arrange accommodation for two people because we encourage the client to bring someone with them if they can. We arrange all of the medical appointments for them and transport within London because most of our experts are kind of concentrated in London. There's some in other places, but those are the ones that we work with. And so we look after them, taking all the stress and the burden away of all those arrangements. We look after them from the moment they arrive in the UK to the time they go back home. And our ethos is to treat every single client as if they were a father, mother, brother, or if it was us, how would we want to be treated? So that's our ethos. The other thing to say is that our USP is that we tend to work with surgeons who employ minimally invasive methods. And that's because we want our clients to have minimal cuts, not open ones if we can avoid them, minimal pain, minimal trauma, minimize the risk of complications and of infection so that they can have a faster recovery and then go to do some sightseeing in London or to Europe.
Well, that sounds wonderful. Now I'm just thinking, I don't know how you can do a hip and do minimum invasive surgery, but that's always fascinating to hear. That's not my specialty. So
Oh, right. So I'd like, I can, if you'd like me to give you an example, I can do that with
sure,
the hip.
sure.
Yeah.
Hmm.
So, I've seen hip surgery done. When I was in training and I went into theatre, I saw hip surgery done, and it was the most brutal thing. I nearly fainted. I was a student
Yes.
nurse at the time, and nearly fainted. And as we know, it is one of the most brutal. So, I mean, those theatres look like carpentry shops, right?
Mm-hmm.
And when you see someone who's had hip surgery, um, you think the pain. You can see the pain etched on their faces a lot of the time, and it takes them a long time to recover. And they tend
Yes.
to have massive scars, so you can't miss the scar, right? Because
Mm-hmm.
they're these massive scars on on their leg, on their hips. We work with a clinic in London where the surgeons take a completely different, a revolutionary approach to hip surgery. Okay, and here's why: because more traditional, even when it's minimally invasive, more traditional surgery, they either go in through the posterior or the anterior, and that means that they've got to cut through muscle and they've got to move the nerves. And so that's why patients are in so much pain, because they've had their hip broken out, then they've had muscles cut
Yes.
and nerves interfered with. With this particular approach, the angle of the cut means that they're cutting in between, so they're not cutting any muscles. They just move the muscles gently aside, and they don't touch the nerves. And so, with this particular approach to hip surgery, less blood loss, less pain, less trauma to the soft tissues, um, and a really fast recovery. Let me explain that. And the scar is 4 centimeters long, not
Oh,
four
wow.
inches, 4 centimeters. So let me explain this. The patients are up and eating an hour after they get back to the ward, which is amazing to me. And then,
Yes.
yeah, right. And then on the same day, they're walking around with the physiotherapist on the same day of surgery within a couple of hours, and they get discharged the next day.
Wow.
So when this was described to me, I thought, oh, wow, that really? this, you know, I was incredulous. I thought, this is absolutely amazing. So we had a patient not long ago, an 83-year-old gentleman who went through the process, and it happened exactly the same way that it was described. He was up and eating. An hour after he came back to the ward, he was walking around. A couple of hours later, got discharged the next day. 83, and he was doing stairs the next day.
Oh, wow. That's amazing. That's amazing.
Yeah,
I've
right.
seen hip surgery,
Yeah,
and it's not for the faint of heart.
right. Exactly.
I saw the mallet and the sticking the joint in, like,
Yeah, and you think,
oh, that sounds wonderful. And I'm like, shoot, why aren't we doing more of that in the U.S.?
and what's really interesting, and for your listeners, this is what's really shocking about it. What I've described sounds like something in the future, but it's happening in the UK now. And what is amazing is that when you think about the cost, so someone thinks, well, okay, well, how much does it cost? That must be really expensive. Um, how much is a hip surgery operation in the US?
Oh, I don't know. I'd have to Google that real quick. It's got to be very expensive.
Well, when I last Googled it, it was between 50 and 70,000, depending on state, etc.
Yep, that's about right.
Yeah, and
Hmm.
that that's just the surgery, without all the add-ons that tend to happen in the US that I've seen myself,
Exactly.
right? So say it's about 60 to 70,000 realistically, could be a bit more. That's just the surgery. We have a package for the hip surgery that I have just described that includes the surgery, 4 weeks accommodation for two people, airport transfers, the transport, arranging all the medical appointments, pre-X-ray, post-X-ray, the consultation with the specialist, and follow-up. So it includes all of that. What do you think that would be? If you were to put a figure on that, I guess
Oh
I'm
my
asking you.
gosh, I would easily think that it'd have to be like 100,000. I'm just thinking about the accommodations alone for 4 weeks,
Yeah.
right?
Yes. It's yeah, it's a long time. Um, and it's really interesting because every time I've asked a nurse in the US how much they think that would cost, that's exactly the figure they come up with, about 100,000 for all of that. And the reason it's 4 weeks is because they have a 4 week check. It's not that they're recovering, and most of them are, fine in terms of their recovery. It's just that there's a 4 week check which we want them to have before they go back home,
Hmm.
and make sure that everything's all right. They have a check X-ray and that sort of thing. But our package that I've just described actually costs around 27,000 US dollars, 27 to 28,000.
That is amazing.
Yeah, yeah, yeah. So, and this is what I mean about people having options.
Hmm.
So someone could fly from the US first class, stay in a really amazing hotel, and still pay less than 50% of what they would pay um, in the US compared to the price here in the UK.
That's amazing. I'm just thinking it's like yeah, our healthcare system is not geared to saving money. I can tell you that much.
I know, I know. And this is one of the reasons why we're so passionate about what we do, because not only can we help people to get the health outcomes that they want, so they can live their life to the full, but it could save them money. And people go to Thailand and Mexico and all these places, and I'm sure the healthcare is fine. However, you hear these stories about what's happening to them, and
Yes.
I always think with healthcare, you know, it's hard enough when you speak the same language.
So we think we speak the same language, but yes.
How many times have you come out of the doctor's surgery, or you've spoken to a consultant and you think, what did you mean by that? And you
Yeah.
speak the same language. So how are how do you navigate when you're not speaking the same language, or it's spoken in an accent that you perhaps don't recognize, and you're not 100% comfortable with? So I always think with healthcare, minimize the risk as much as you possibly can. you know
Yeah, definitely. And what you're describing sounds so innovative. And how did you come up with the model? I mean, how did you get introduced to the company, or because it says you're a co-founder, so how did you all come up with it?
okay, so um a lot of my decisions, I was really close to my dad, who sadly passed away now, but I was very, very close to him, close to my mum as well. Um, and so there was a time when my dad was ill and needed a spinal operation, and he lived in the Caribbean. And I thought to myself, I don't want him to have an operation there. I want him to have the best possible care. So I was, working at a hospital at the time. I did extensive research. I found the best neurosurgeon in the UK. I made all the arrangements for him. He came over, saw the consultant. He said, yes, we need to do an operation. And it was an operation, quite, a major operation on his spine. So I was terrified, as you would be.
Yeah, yeah.
And the surgeon described the fact that he would be in ICU. And as a nurse, particularly, when you hear ICU, what do you think? You're thinking tubes. They look, you know,
Hmm.
they're asleep. It's not a good image in your head.
Right.
So I remember waiting to hear. I was sitting with my brothers, and we were chatting away, and we were waiting, and to hear from the surgeon. I remember him coming out. He just operated on my dad. He came out and he said, the operation went well. And surgeons will say that because it's from their point of view.
Right.
The,
Yeah.
right?
They're
And you
still
think,
alive, breathing. It went well.
yeah, right. So you're thinking, I need to see it myself because I don't know what. I'm glad it went well. I'm thrilled, but I need to see my dad. And I remember walking down. He said, "You can go and see him." And I remember shaking, and I was walking down the corridor, massive corridor. It was a private hospital, and we were going towards the ITU. And I remember the door leading to the ITUs, this double door. My knees weren't taking me where I wanted them to go. I had to hold on to my brother. And we were walking down the corridor, and as we got to the door, I was at the front. And I remember trying to push the door, but I didn't have the strength to do it because I was so nervous about what I would see, how my father would be looking. I was thinking all these tubes, and my imagination was going wild, because he's had major spinal surgery.
Mm-hmm.
So I remember my brother actually pushed the door open, and as the door opened, my father was the first patient. And when I saw him, he looked as if he was sitting up, having this really lovely meal of salmon, and he looked as if he'd had the best facial ever. His skin looked amazing because he had spinal stenosis, so he before then he just didn't look well. His skin looked amazing, and he smiled and he said, "Come in." And that's when I kind of gave way to tears because of the relief. I couldn't believe what I saw. And then I was looking for where, I thought he'd be on a board, on a stability board,
Yeah.
So none of the things that I envisaged I saw, and that confused me. But I was relieved at the same time. And
Yeah.
what
I was
really stood
imagining
out,
like a halo and
yeah, right,
yeah.
hips, and all I saw was this plaster on his neck. That was it, and that was where the operation was done because it was a minimally invasive operation.
Wow.
And we were there for 20 minutes. We were obviously overjoyed. I was in tears. I was so happy. And then he said, "Oh, you have to go now because I've got to have my physio." He just had a major spinal operation. Um, and to cut that long story short, he was discharged 3 days later and he recovered really well. And I remember thinking, I want to do this for other people. I want other daughters to experience this. I want sons and wives and husbands. And I thought, I want to do this for other people. And that's where the idea came from.
That's amazing. That is amazing. And I say kudos to you because I never would have thought to do that and have it open to international clients that can, afford to pay cash. I don't know if, and then maybe later they could turn into their insurance. I don't know. But I just think that's amazing to me that you came up with this concept and was able to implement it. How long have you been around with your company?
Yeah, well, before I answer that, just to pick up that issue with the insurance, we
Mm-hmm.
do have people whose healthcare gets paid for by the insurance because some American companies or international companies actually, if they're going to be saving money, they support their clients going elsewhere. And because the UK is quite recognised in terms of the quality of care that's delivered here, the insurance would be happy to pay for the UK for them to come to the UK rather than go to Turkey or Thailand or Mexico or somewhere else. So I'm not I'm not dispelling what they do at all, but that's just the reality. And so we do have clients that have their insurance pay for their healthcare. And sometimes what they do is they pay for it by credit card and then the insurance reimburses them.
Okay, yeah. I was just thinking, and here I am doing prior authorizations. They get a medicine that costs $4.
There you go.
I just think our healthcare system is just missing the boat in some ways. I mean, there's just some things that they could do to that are really cost effective
Oh,
and have better patient outcomes.
yeah.
Yeah.
Yeah, absolutely. So to
Mhm.
answer your question about how long we've been up and running, we actually launched just before COVID.
Fortuitous. Yeah.
And then of course COVID hit and that was it.
Yeah.
So yeah, but we just, as soon as things started opening up, we started getting that momentum going again. We're still in that process of, getting the momentum going and getting people to think about the options that they have, the safe options that they have for healthcare.
Well, I think that's wonderful because I like the idea of people having options. You
Yeah.
know, what works for one person may not work for the other. And I had a niece who flew, I think it was to Honduras to have a surgery because she just didn't. It was a cosmetic surgery. She just didn't want to have it here in the U.S. because it was too expensive. And I think she ended up getting that done. And it's just it's sad that in the U.S. healthcare is so expensive. And if you don't have insurance and you're not quite eligible for um, federal insurance or state insurance, you kind of have to pay everything out of pocket.
Yeah.
Yeah,
Sure.
unfortunately.
Yeah.
Well, I want to say thanks for coming on the show and giving us this great information. I think that's wonderful. I did see that you did have an offer for our listeners, and so you want to tell us about the offer?
Yeah, just you know, the thing that makes up the our treatment packages, um, like the one that I've just explained, i.e. the hip replacement. We don't have packages for absolutely everything, but there are certain packages. Um, so we have the cost of the treatment, and that is combined with the Metta Health fee. So our fee for, the concierge fee, and that kind of makes up the treatment package. And so the offer for your listeners is that if they and this is open until December the 31st. If they
Okay, well,
want
your episode probably won't go up till January.
oh,
Just to warn you.
okay. Okay. So I need to say January 31st.
Okay.
Um when in January will it um yeah, so till the kind of till the end of January, they could have 10% off if they use the special code that we've given, which is Tina B10.
Yeah.
And so they can have 10% off the Meta Health fee.
Okay, that's great. Well, hey, listeners, if you're hearing that, that's 10% off of an already discount if you're in the US. If you're anywhere else in the world, I don't know what a discount would be for your healthcare, but you know what? 10% is 10%, and that can add up. And that would be a great cost savings. And so I want to thank you for offering that to our listeners because I think that's wonderful. And
Thank you.
so, our last question is if you were to talk to a budding entrepreneur or a nurse who wants to start out, what would be your best advice?
Um, my best advice would be do your market research. Spend a lot of time doing your market research, and make sure that if you're going to have a business partner, make sure that that person has skills that complement to yours and that
Definitely.
they're as committed as you are.
Yes, most definitely. Because you know what? You might end up in a pandemic and then you got to put things on hold. You got to keep the team together, right? To keep the dream alive.
Yeah, absolutely. And it's just this thing about measuring twice and cut once.
Yes. Yes. Exactly. So your listeners can reach you at metahealth.com UK. That's METTAHEALTH.UK, or email you at inquiries@mettahealth.uk.
Yes, absolutely.
All right. Well, thank you for your time. It was great having you. We could talk for hours, but it's time for us to go. So I want to thank everyone for tuning in to the Nurse Shark Academy show. Don't forget to check out our other podcasts. Watch us on YouTube and subscribe. Leave us a comment. Follow us on Podbean or wherever you get your podcasts. We are there. And you can always join us at the nursesharkacademy.biz as well. Thank you for tuning in, and see you next time.
Thank you so much for having me.
Oh, you're more than welcome. My mission is for you to own your seat at the table of nurse entrepreneurship, gaining confidence, skills, and freedom to live your life on your own terms. I specialize in working with nurses and other health professionals who want to reduce burnout, pessimism, and compassion fatigue, so you can become a successful entrepreneur to reclaim the love you have for your profession and to create a fulfilling and prosperous life. Join the Nurse Shark Academy at thenursesharkacademy.biz and come feel the sun, providing a clear path for business success. Thank you for listening to the Nurse Shark Academy show wherever you get your podcasts or watching us on YouTube. Don't forget to like and subscribe, and don't forget to hit the notification bell so that you'll know when all of our episodes come out. If you want further information, you can contact us on the nursesharkacademy.biz.